Heavy menstrual bleeding, also known as menorrhagia, it is a common and significant health concern that affects many women. When women have heavy menstrual bleeding, whereas many women might feel isolated, thinking that they are the only ones experiencing such heavy periods, but when in reality, it is a prevalent issue among many women who needs help. Heavy menstrual bleeding is not merely a matter of inconvenience or discomfort, it can greatly impact a woman's physical, emotional, and social well-being. Menstruation, also commonly referred to as a period, is a natural physiological process that occurs in reproductive age females. During a typical menstrual cycle, the lining of the uterus, known as the endometrium, thickens in preparation for a potential pregnancy. If pregnancy doesn't occur, the uterus sheds this lining through menstrual bleeding. Menstrual bleeding usually lasts for about 3 to 7 days, with an average blood loss of about 30 to 80 milliliters. However, in cases of heavy menses, the bleeding is much heavier and lasts longer than usual. Clinically, heavy bleeding means you lose more than 80 milliliters of blood each cycle of your periods, that lasts longer than 7 days. This condition can be distressing and disrupt a woman's normal routine, affecting her overall quality of life. Menorrhagia can have various underlying causes, including hormonal imbalances, uterine fibroids, adenomyosis, polyps, blood disorders, intrauterine devices, and certain medical conditions like thyroid disorders or pelvic inflammatory disease or some medications. In some cases, the cause of menorrhagia may remain unknown. Women with heavy menstrual bleeding often experience a significant amount of blood loss during their periods and may also pass large blood clots, which may last for more extended periods than usual. The excessive blood loss can leave women feeling drained and can cause anemia, which leads to fatigue, weakness, dizziness, and difficulty concentrating, which can impair their daily activities and overall productivity. Managing heavy menstrual bleeding is essential to improve a woman's quality of life and prevent complications. Early diagnosis and appropriate management can help prevent complications and improve overall well-being. We can empower women by promoting awareness and access to appropriate medical care to manage this condition effectively and lead healthy and fulfilling lives. Homeopathic treatment helps women recover completely from heavy menstrual bleeding. The aim of homeopathy is not only to treat the present symptom, that is heavy bleeding, superficially, but also to address its root cause and to heal the patient from within. It helps to treat the disease as a whole and not just a symptom. So, it establishes the balance at a physiological or physical level and in the emotional, mental state. Let us encourage an atmosphere where women feel comfortable seeking help and discussing their experiences. You can contact Dr. Sheela Homeopathic Healthcare Clinic on 9500049892 for heavy menstrual bleeding treatment and